Know the facts. COVID-19 vaccine in Birmingham. May 2021. What's inside? What are vaccines? Vaccine safety. Vaccine and religion. Booking appointments and what to expect. Side effects. Tackling misinformation. Quotes across the community. Latest updates. Message from Councillor Hamilton, Holyhead Ward and Cabinet Member for Health and Social Care. Since the effects of COVID-19 became apparent in early 2020, it has been our hope that the vaccine would be created to protect against it. There weren't many who believed that this aim could be achieved in less than a year, or that more than one vaccine could be produced in such a short time. Yet this is exactly what happened. I can say from experience that people of Birmingham have played their part in reaching this point. From the research conducted in universities, the commitment shown by our healthcare professionals, to the efforts of our public to control the virus. And so, to make sure we take this full advantage of this amazing opportunity to regain control of our lives, Birmingham City Council have produced a vaccination toolkit. Whether you're unsure about the process of getting a vaccine or concerned about its safety, the following passages will provide everything you need to know. I urge you to read it and share it as far as you can, keeping not only yourself safe, but your family, your community, and your city safe as well. Message from Dr. Justin Varney, Birmingham Director of Public Health. The COVID-19 vaccination programme is the biggest of its kind in the history of the NHS, and we have all worked together to ensure its success so we can start to rebuild a better future coming through the pandemic. We all have a huge stake in this, and so it's vital that we make the right decisions. Having worked on the response to the pandemic since the beginning, however, I know from experience that misinformation can spread just as quickly as the virus. We know that the lack of understanding is one of the major barriers to people taking up the vaccine, and through this toolkit we aim to give the public information in an easy, accessible way to answer people's questions. The toolkit is about providing accurate facts and reliable advice to give you the confidence to talk about the vaccine with people you connect with so that they can be more informed and make a decision about the vaccine based on facts and evidence. What are vaccines? Vaccines are the most effective way to prevent infectious diseases such as COVID-19. They prevent up to 3 million deaths worldwide every year and are one of the greatest discoveries since the early 1800s, when the first vaccine for smallpox was first developed. They work by teaching your immune system how to create antibodies to protect you from diseases. It's much safer for your immune system to learn this through vaccination than by catching the disease itself. Dr. Sonia Ashraf. Dr. Sonia Ashraf, Governing Body, Central Locality, Lead GP. As a Birmingham GP, I feel it's part of my job to advise the community on the importance of taking up the COVID-19 vaccine. We are here to listen to you and answer your questions. We are here to provide support and guidance. If you get the invite and you're still not sure, please speak to your GP. COVID vaccines safety. In the UK, there are currently 3 types of COVID-19 vaccines approved for use. All vaccines have met strict standards of safety, quality, and effectiveness as set out by the Independent Medicines and Healthcare Products Regulatory Agency, the MHRA. They all require 2 doses in order to provide the best protection and have gone through 3 stages of clinical trials and safety checks. Although these vaccines have been developed quickly, these safety requirements have been assured by the MHRA, and the speed reflects how scientists have worked collaboratively and with the wealth of funding available. This is the exact same process that all other licensed medicines go through in order to ensure their safety. New clinical research trials are started each time a new variant of coronavirus appears. And so these trials have shown that the current vaccines in the UK are effective in preventing death and reducing infection rates in the new variants. The vaccine prevents you from getting seriously ill from COVID-19. But you can still pass the virus to someone else, which is why you must still follow the local national guidelines. You must also take up the offer of your second vaccine when offered. The good news is that emerging evidence is now showing that not only will the vaccine prevent you from getting seriously ill with COVID-19, but the vaccine may help reduce transmission of the virus. Is the vaccine compatible with my religion? The Catholic Church have said the vaccines are acceptable and can be morally justified. The British Sikh community supports the vaccine. The Hindu Council actively encourages members of the community to take the vaccine. The Church of England says that all vaccinations can be used with a clear conscience. The British Islamic Medical Association has considered all variants of the vaccine and recommends that Muslims have the vaccine. The Muslim Council of Britain have confirmed that all varieties of the vaccine are halal. Jewish doctors in the UK have signed a letter to confirm that all vaccines do contain any ingredients that are not kosher. Orthodox Jewish groups have also encouraged their members to get the vaccination. The vaccines contain approximately 10 ingredients. They do not contain animal products or egg, so they are vegan and halal approved. Nor do they contain alcohol. To find out more, you can look at information from the Green Book or the MHRA. Sadul Haq, Lead Organiser, Citizens UK, Birmingham. Sadly, many of us have known someone who's passed away in the past year because of COVID-19. The virus has devastated households and in particular our less well-off neighbourhoods. Despite places of worship facing huge opening restrictions, our city's faith and communities have been at the front line of helping those most in need throughout the year. Today, the same leaders are urging everybody to take the COVID-19 vaccination when called to do so, as they remind us how the vaccine complies with our religious beliefs. How do I book my vaccine? People who are most at risk of COVID-19 are being offered the vaccination first. It's important to still get your vaccine even if you've had coronavirus, as studies have shown that you may not have long-lasting immunity. If you meet the current priority criteria, you can still book your appointment online for one of the mass vaccination sites, and these are Millennium Point, Aston Villa, Edgbaston Cricket Ground. To find out if it's your turn or how to book, you can visit the NHS website shown. You may also receive a text from NHS Vaccine inviting you to book your vaccination appointment or to go to a local NHS service such as your local GP may give you a call. Attending your appointment. You'll need to bring a face covering unless you cannot wear one for a health or disability reason, your booking reference numbers if your appointment is at a vaccination centre, your NHS number that can be found on the website stated. What happens at the appointment? Your appointment should last for around 30 to 45 minutes. You'll be asked some questions about your medical history. It's important to tell the staff giving you the vaccination if you have ever had any severe allergic reactions or pregnant. Currently, you cannot choose which vaccine you will be given. The good news is that all vaccines are safe and effective, and studies have shown they work well in preventing serious illness. Having the vaccine will take a matter of seconds, and although everyone's pain threshold is different, you should only feel a small pinch or scratch. The COVID-19 vaccine is usually given as an injection in your upper arm. It takes 12 to 14 days to build an immune system response, and you will have an even better protection after your second dose. You should be able to resume activities if you feel well. If your arm is particularly sore, you may find heavy lifting difficult. If you feel unwell or very tired, you should rest and avoid operating machinery or driving. Side effects. Most side effects are mild, only lasting 48 hours, and not everybody gets them. This is similar to other medication. Common side effects include having a painful, heavy feeling and tenderness in the arm where you had your injection, feeling tired, headaches, general aches, or mild flu-like symptoms. Feeling feverish is not uncommon, although a high temperature is unusual and may indicate you have COVID-19 or another infection. If your symptoms seem to get worse or you're concerned, call NHS 111. If you do seek advice from the doctor or nurse, make sure you tell them about your vaccination. Chris Dunbar, Sexual Health Promotion Worker, Birmingham, LGBT. I've been working with the LGBT community throughout the pandemic, and I know how worried and isolated people have been feeling. I had my first dose of the vaccine in January. It was quick and painless and has made me feel so much more confident that life can return back to normal soon. I would encourage everyone to have the vaccine when they are able to do so. Until then, stay safe and support each other. Key things to remember. The COVID vaccines are safe and have gone through the same trials as other medications and vaccines. One dose offers you some protection, but your second dose will give you the most protection. It is important to attend your second appointment. If you have any concerns about the vaccine, please speak to your local GP who will be able to advise. Trials have shown that the current vaccines in the UK are effective in preventing death and reducing infection rates in the new variants. Despite emerging evidence showing that the vaccine may help reduce transmission of COVID-19, until we know more, you must still follow the local and national guidelines and make sure you practice good hygiene such as wearing a mask and washing your hands. Locate your NHS number before your appointment and please check the website stated. Latest updates: blood clotting and Astrazeneca. Recently, there have been reports of an extremely rare condition involving blood clots and unusual bleeding after the COVID-19 Astrazeneca vaccination. This condition can also occur naturally, and clotting problems are a common complication of the COVID-19 infection. Although this condition remains extremely rare, there appears to be a high risk in people shortly after the first dose of Astrazeneca vaccine. This is seen slightly more often in young people and tends to occur between 4 days and 2 weeks following the vaccination. By 31st of March, 20.2 million doses of the COVID-19 vaccine Astrazeneca had been given in the UK, meaning the overall risk of these blood clots is approximately 4 people in 1 million who receive the vaccine. The benefits of vaccination continue to outweigh any risks, but the MHRA advises careful consideration to be given to people who are at higher risk of specific types of blood clots because of their medical condition. The UK vaccination programme has been very successful, with more than over 30 million people vaccinated and more than 6,000 lives already saved. Risk of blood clots. Astrazeneca vaccine. 4 cases in 1 million vaccines with a percentage of 0.004%. Birth control pill. 1,200 cases in 1 million women, meaning a percentage of 0.12%. Smoking. 1,763 cases in 1 million smokers, meaning a percentage of 0.18%. COVID infection. 165,000 cases in 1 million infected, with a percentage of 16.5%. Benefits and risks of Astrazeneca vaccination. As you can see, there are 3 different age brackets and each show the benefits and risks. The over 50s has 3 separate columns. Benefits of the vaccine, risk of the vaccination, risk of COVID. Each age group has 3 different sections. First vaccine, second vaccine, and no vaccine at all. So, the over 50s, with 1 vaccination, more than 80% reduction of deaths, hospitalisation, intensive care. With the second vaccination, more than 95% reduction of deaths. Risk of vaccination, with 1 vaccination, uncommon, sore arm, feeling tired, headaches, general aches, flu-like symptoms. Second vaccination, extremely rare, clotting problems. Risk of COVID, 1 vaccination, low, catching infection, passing on infection. Second vaccination, moderate, long-term COVID. No vaccination, very high, hospitalisation, intensive care admissions, death. (30 to 49). Benefits of vaccine, risk of vaccination, risk of COVID. With 1 vaccination, 2 vaccinations, and no vaccination. With 1 vaccination, between 60 and 70% reduction catching infection, passing on infection. 2 vaccinations, more than 85% reduction catching and passing on infection. Risk of vaccination, 1 vaccination, common, sore arm, feeling tired, headache, general aches, flu-like symptoms. 2 vaccinations, extremely rare, clotting problems. Risk of COVID, 1 vaccination, low, hospitalisation, intensive care admission or death. 2 vaccinations, moderate, long COVID. No vaccination, high, catching mild infection, passing on infection. (18 to 29) age group. benefits of vaccination, risk of vaccination, risk of COVID, with 1, 2 and no vaccine. So 1 vaccine, between 60 and 70% reduction catching infection and passing on infection. 2 vaccinations, more than 85% reduction of catching and passing on infection. Risk of vaccination, very common, sore arm, feeling tired, headaches, general aches, and flu-like symptoms. 2 vaccinations, extremely rare, clotting problems. Risk of COVID, 1 vaccination, very low, hospitalisation, intensive care admission, and death. 2 vaccinations, moderate, long COVID, and no vaccination, very high, catching mild infection, passing on infection. Tackling misinformation. There are plenty of people who have concerns, questions, and uncertainties around the vaccine. These may not be the same as other people who are not willing to take the vaccine, although both can stem from misinformation. We all play a part in making sure that misinformation does not spread to others, and this handy graphic on the right demonstrates this. This person sent a rumour via group chat. The next person got their news from a trusted source. The next person double-checked facts. And the last person asked, how do you know? How do you know that's true? If you would like more information on the infodemic and misinformation, the World Health Organizations have made a really useful booklet which can be accessed here. Dr. Onyi Okonkwo, GP, the Wand Medical Centre. As GPs, we have to watch people lose loved ones, while we ourselves have lost patients and members of our communities during the pandemic. Finally, we have vaccines which are effective and can prevent further deaths. Please consider taking the vaccine when it's your turn. Let's protect each other and the NHS. What can you do? Not everyone will feel confident about getting the vaccine. Here are some tried and tested techniques to support your conversations about the importance of getting the vaccine. Understand the barriers. When speaking to people, try and work out if their objections to the vaccine are practical. If so, try and identify what the potential practical barriers might be if required. Refer them to community support if available. Challenge misinformation. If you hear misinformation, in a calm manner, constructively challenge this. Make sure you actively listen to their concerns and ask the individual to refer to reliable sources of information such as NHS, gov.uk or their GP. Remind them about safety. All the vaccines have gone through rigorous development and testing processes. All research has gone through forensic, evaluation from the independent regulatory to ensure their safety. Remember to be patient and understanding. In the community. Angela Huang, Chair of Chinese Active Citizens UK. I've been supporting the community to fight against the virus in the past year, so I understand how difficult it has been for everyone. Now we can see the light at the end of the tunnel, but we still need to follow the rules and take the lift step by step. Otherwise, we'll risk the efforts we've made so far. So please continue following COVID-safe guidance, and remember, you can always get support from your local community if you need any help. Amina Ibrahim, ODP healthcare worker at St George's Hospital. Healthcare workers like myself have been fighting against misinformation with equal determination as the virus itself. The pandemic has shown us it is dangerous and it kills. The human cost will become more apparent as time goes on, but in the meantime we can all play our part. Think before you forward that message or video. Always verify the information you see and share. The best guidelines can be found on the Council's web pages, the NHS website and official government pages. Bradley, Youth COVID Champion. I'm vulnerable and I've had my vaccine. I have played my part in this, and now it's time for you to do yours. Please get the vaccine and save lives together. Tarang Shalat, former Chair, Birmingham Council of Faiths. Regrettably, many of us have lost someone in the family as a result of catching COVID. The grief of losing a family member well before their time is unbearable. We now have the option to prevent this for you, and by encouraging members of your family and community to take the vaccine when you're invited. I myself had my second Astrazeneca vaccine last week and have suffered no side effects. We all need to take a leap of faith and trust our scientists, ignore misinformation, and let's support our community to ensure we all follow government COVID guidelines. There's a light at the end of a very long tunnel. Stay safe. Reverend Maxine Douglas, West Midlands Faith in Action. When all the closed doors all around us begin to open, the messages of hope and the resemblance of living a normal life can clearly be seen. Places of worship and people of faith have been extremely consistent in supporting the battle to protect lives and save the NHS. We extend sincere gratitude to all our frontline workers, scientists, and those who have worked tirelessly behind the scenes. The vaccines bring clear hope for the future, but we must remain vigilant and compliant, for this too shall come to pass. Nathan Dennis, Director, First Class Foundation. I know it's been hard, but we're all nearly there. Stay at home, protect the NHS, save lives. Please ensure you do the necessary research with yourself, your family, to myth bust and make your decision. Together, we can do this. Contact us. You can contact us with any questions, comments, and feedback via the following channels. You can email healthybrum@birmingham.gov.uk or website www.birmingham.gov.uk. Social media channels. Following us on social media to keep you the latest news and updates. This is a great resource for lots of great content to reshare and amplify. Birmingham City Council have their own social media, as seen. Birmingham Public Health have their own social media, as seen on screen.